Hello, welcome back to Skin and All YouTube channel, the channel where we talk about all things skin related, all things related to mentoring, relationships, life lessons, humor, different things. It's a mix of this and that, but it's majorly about the skin. So today, what are we going to be talking about? I'm sure you can see from my bare face already that I'm here to give you some tips that will be useful in your skincare journey. So as always, have you subscribed to my channel? You are missing out on a lot if you have not subscribed. You can give us a like, give us a thumbs up, subscribe to my channel, comment. It's an interactive YouTube channel. I would make sure I reply, and respond to all your questions. So today, what are we talking about? We are talking about from bare to slay. What do I mean from bare to slay? So I want to take you through my journey or through my morning routine before I go to, as I'm getting ready for work. How I take care of my skin, how I apply my makeup, what I call my makeup, because you're going to see the almost non-existent thing that I have in my makeup bag. But those are the constant things that I use every day. So I have a pretty oily skin. And I think I've talked about it here before on one of my former episodes where I was talking about acne. That one of the problems of oily skin, or one of the issues that can come with oily skin, is acne. So oily skin is prone to having both adolescent acne and even adult acne. That's acne in people over the age of 25 years. Unfortunately, one thing about acne is that it has no respect. In fact, skin lesions generally, you don't have respect. Whether you are a dermatologist or an esthetician, they will still come visiting, especially if you have the skin type for such lesions. So I have oily skin and that's acne prone skin. So I suffered from adolescent acne. I still suffer from adult acne. That's acne in people over the age of 25 years. So I want to take you through my routine, and it's something that if you have oily skin, you can adopt my routine. You don't have to use exactly the products that I'm using, because this is not an advertisement for any product per se. I'm not a product junkie. I don't go from one product to the other. At the same time, I'm not particularly in a monogamous relationship with any product. So it's the active ingredients of the product that matters to me, and again, how my skin tolerates whatever it is that I'm using. So for example, if any people are raving about a particular product and you use it on your skin and it doesn't agree with your skin, no matter how much people are raving about it, then it's not the product for you if your skin does not agree with it. So without further ado, my skin is bare, nothing. I have no makeup, nothing on my skin. You can see my brows looking like that of a plucked chicken. Like I said, skin lesions, the type of skin that you have, is no respecter of whatever profession you are doing. So I'm a dermatologist, and yet my brows, I'm deficient in brows. That's one congenital absence that I have. I don't have brows naturally. So if you see me early in the morning, I can look like like a plucked chicken where all the brows have been plucked off. And this is not like I plucked it off myself. I actually naturally don't have. So I refuse to go out or go to work like this. So I try to fill in my brows before going to work. And like you people always say here, dermatologist, is there something with Dove moisturizing soap? So there's really nothing. It's not like we have an agreement or we have a paid sponsorship with them or anything. But we tend to recommend cleansers or soaps, cleansers basically, that clean dirt and impurities off your skin, that the pH is compatible with the skin. And one of the most available and affordable ones in this environment is Dove. So that's why we really recommend Dove moisturizing soap. There are other ones. You have Sebamed, Aveeno, Oilatum, Eucerin. There are several ones. And even if you can't go for any of these ones because they may be unavailable, they may be expensive, if you can't go for any of these ones, just make sure you are using regular toilet soaps. You don't need to use medicated soaps or be putting antiseptic solutions in your bathing water, except for some certain situations. Maybe there's an infection that we are trying to treat, but generally for your daily routine, you really don't need to be using antiseptic soaps. You also don't need to be using any of those hard sponges to scrub your skin and scrub. Nigerians, I don't know what it is with us. We like to scrub the skin, and we just keep scrubbing on and on and on. So you really don't need to scrub your skin. Your skin is not that dirty. And even when you finish scrubbing your skin, if you come back again and you clean it, the skin is constantly shedding, you know, so it's not unusual for you to still have some things looking like dirt on your skin. Okay, so like I said, my cleanser or my bathing soap is Dove moisturizing soap. That's what I use. That's what we all use in our family. But I have oily, acne prone skin. In fact, I still had an episode, for women close to your period, ovulation, you might break out even more. So I still had an episode recently, but I'm the dermatologist. I should be able to heal myself. So I've had a chemical peel recently. I'm still healing from the chemical peel that I had. But generally, when I'm not breaking out, when I do not have any acne lesions on my face, I tend to use a mild cleanser like CeraVe. So that's what I use when I'm not breaking out, and I've used that to wash my face before starting this video, and I use that, put a bit of it on my hands and wet my face, and after wetting, and that's to allow the cleanser to glide on your face easily. So I put the cleanser on my face and wash gently, TLC on the face, and you use the cleanser about 1 minute, and you wash your face and you rinse it off. Okay, that's that for when I'm not breaking out. And before you start saying, oh my god, she has a lot of products, this is not even anything, because if you check the stash that some people have, they have so many things that they become confused. But I have them for different periods. So when I'm not breaking out, this is what I used to wash my face. On the other hand, when I'm breaking out actively, like I have a lot of acne on my face and I'm breaking out, I go for this. It doesn't have, this is advanced rejuvenating concepts. It doesn't have to be this particular one. I like Diva skin products. I like this product. It can be any one as long as it contains the active ingredient. So this contains 5% benzoyl peroxide. But the thing about benzoyl peroxide is that you don't want to be leaving it for too long on your skin. So the way some people apply their bathing soap on their face and they leave it on. If you do that with benzoyl peroxide, you shouldn't even be doing that with any of your products. You shouldn't be leaving, your cleanser on your face for too long, because some of them, they might have an irritating effect on the skin, except it's maybe like a mask or something. That is different. So if I want to use this the same way, wet my face in circular motions and just use it to cleanse the face and wash it off. So this is what I use when I am breaking out actively, or maybe close to my period, close to ovulation, when I know I would break out. But you don't use benzoyl peroxide every day when you're, and that's the mistake a lot of patients with acne sometimes make. When their face is calm, they now continue to use the benzoyl peroxide every day. You dry out your skin, and the skin thinks that, oh, there's no sebum on this face, and more oil is produced because of that. So you don't want to be using this every day when you are not breaking out. Okay, sometimes when I'm breaking out but it's mild, this is Paula's Choice. I really like Paula's Choice. I love her products. Like I said, this is not a paid advertisement or anything, or paid branding or sponsorship for any particular product. I'm just giving you my routine and some of the things that I love. So I love Paula's Choice, this salicylic acid pore cleanser. I really like it. It does the work too. Milder than benzoyl peroxide, and it does the work. So, and this one, you can actually use it every day, even if you don't have acne, unlike benzoyl peroxide. And so even this one too can tend to dry out the skin. So if you notice your skin is drying out, please go back to your regular cleansers that are mild for your skin. So that's that. So I've washed my face with the CeraVe before starting this video. So the next thing after that, my face is all clean and all that. Once I come in and my face is dry, the next thing I use is my toner. This is Naturium. It has 2% salicylic acid. The thing with salicylic acid is that normally I wouldn't encourage you to use something that has salicylic acid on the regular like that. But there are some products that are really mild. This Naturium product is one of them. Paula's Choice too also has a 2% salicylic acid toner. But this particular one is really mild and gentle on the skin. The only thing I don't like about it, some other people might like it. The only thing I don't like about it, I don't like the smell. It has one funny smell that I don't particularly fancy. But you can use your palms, just apply it on your face. You don't have to use a cotton pad. You can use just your fingers Your clean fingers, apply it all over your face, all over, okay? Your face and your neck and all that, so all over. Yeah, just like that. Okay. Let's see. I usually do this in front of my big mirror, but I like the small mirror because it gives me, I'm able to focus very well on my face. So I apply it all over the face. And that's, you can see my face already looking, it's kind of, it has salicylic acid, but it also hydrates. I like the toner. It's just the smell I don't really fancy. Then after that, I don't know, but for one reason or the other, maybe because they are really gentle on the skin, and I like the way they blend into the skin easily. I really like Naturium products now. I am getting to love their products a lot. So I use this niacinamide gel cream. That is what I use afterwards. And just, you don't want to rub it. One thing you shouldn't do with your products, don't rub it all over your palms. Your palms, you're not treating your palms, you're treating the skin. So what I do with this is just, I just put it in bits. Okay, put it in bits over my face, and I just blend it all in, just put it all in. And I forgot to mention, it's a gel cream. It's a cream in form of a gel, so it's like a mixture of a cream and a gel. And when you have something, if it's just like an ordinary gel, it dries out so fast, but because it also has a cream incorporated into it, so that's why it is also moisturizing. And because I have oily skin, this is good for me. Okay, if you have dry skin, you're better off with just a cream, nothing with a gel in it that dries off so quickly. So this is perfect for me. It's very light and it blends in easily. I love it so much. Okay, so and that's the next thing I use after the toner. I should mention that on days when I really need to get to work quickly, there are some constants. I may not remember to use my toner, but I definitely remember to use my niacinamide gel cream. Then of course after that is to use my sunscreen. And I've talked about this Maisha Aqua sunscreen before. I think Korean products are taking over the market when it comes to skincare. I love Maisha Aqua. And one of the reasons why I really love it, for black skin, we complain about we have cast on the face after using sunscreen. I've used a lot of sunscreens, and I like this because it is affordable and it blends in very easily. It doesn't leave a cast. Remember the 2-finger rule? So with the sunscreen, so I put it at the back of my hand. Remember I said you are not treating your hands. So you don't want to rub your products on your hands. You just want to put it, at the back of your hands, and you apply it gently afterwards. So I take my mirror again and we start to dab it in. Just look at how it's gliding. Just look at that. I love Maisha Aqua, honestly. It's my go-to sunscreen, especially if you have oily skin. If you have dry skin, you may go for something like Black Girl sunscreen. I like Black Girl sunscreen too, but if you have oily skin, it may not be so appropriate. Okay, so you blend it in, all over. Put it in. We're not going to waste any sunscreen. Everything is going all in. Especially since I told you I just had a chemical peel last week. Was it last week or almost 10 days ago now? So I'm still healing, I'm still peeling, and the sunscreen is your friend, your neck, your chest, everywhere. You want to apply the sunscreen everywhere. So that's it. Blend it in. Can you see how well it's gliding in? My face is all shiny, but no residue, no cast, nothing. Everything is going all in. I really love the sunscreen. It's amazing. So this is not to say there are no other good sunscreens in the market. There are a lot of other sunscreen that you will also like. So I've given you one. I love Eucerin. I love La Roche-Posay. I like Elta MD. They make good sunscreens too. So any of those ones and any other ones, as long as the recommended SPF is in the sunscreen. And remember, what did I call it? Sun protective factor of between 30 to 50. That's what you want to aim for. Anything less than 30 may not be protective enough, and over 50, you know what we Nigerians call oversabi. That's what over 50 sunscreen is. It's not really offering any added benefits, and you are just it's just a marketing gimmick. Let's put it that way. So you want your sunscreen's SPF to be between 30 to 50. So yeah, so I brought this. Anyway, we're still doing the morning routine, but before I forget, I was talking about oily, acne prone skin. So before all of this, if you have a breakout, maybe you are breaking out, you have acne on your face, what you should do before applying your sunscreen, before applying your moisturizer, you can do some on-the-spot treatments. So this is benzoyl peroxide. This is 2.5% benzoyl peroxide. Make sure you're not using more than 5%. If you're using more than 5%, you can, but the thing is, a lot of people tend to get skin irritation with 10% benzoyl peroxide. So before applying, I skip that step because I don't have breakouts on my face presently. But if you do have, you want to be using something between 2.5 to 5% benzoyl peroxide cream as an on-the-spot treatment. Just apply on the acne before your moisturizer and before your sunscreen. Or salicylic acid. Some people don't tolerate benzoyl peroxide well, so it might be salicylic acid, but not the two at the same time. So you can tweak it. You can have a benzoyl peroxide wash, a salicylic acid cream, or a salicylic acid wash and a benzoyl peroxide cream. So that's that. So we are done with the sunscreen. That's my morning routine. That's all. I don't have any other thing that I use. Basically that. So remember the 3 basic steps: you cleanse, you moisturize, you use your sunscreen. Then you start to add on antioxidants like retinol, green tea. You can start to add those ones on. So retinol and retinoids, retinol, all of them, it's better used at night preferably. So that's usually my night routine. So I'm done, and I said from there to sleep. So please, this is my own idea of sleep. I don't have much time to do a lot of makeup in the morning, and I also don't have time to use foundation, brown powder every day. One problem with my face is that if I do that every day, I'm going to get a lot of breakouts, no matter the type of product I'm using. I used to use I've gone from MAC, I've done Black Up, now I'm using Mongolane, I'm using Estee Lauder, yet I still break out when I apply foundation and brown powder on my face every day. So what I do every day is that I use Pond's All Control White Powder. That's what I do every single day. Except I have a party, except I have an event or something, then I get somebody to do makeup or to do something extra for me. So I put the powder just right there, and I put the powder on my face, and this is the one where you can, put it over your hands, rub it together. And so what you can see is that the oil on my face, so what powder does is that it absorbs oil. This white powder, they absorb oil, and you see that my face, all the oily skin that you noticed after I applied my sunscreen and all that, everything is calming down. Yeah, the oil. So I'm going to put a bit more. I think I need a bit more. So just a little bit more. So the same thing, put it on my face. So this is every day, every day. This is my everyday routine. I don't use the powder. And I wonder, the people that do makeup and dress up for a living, I don't know how they do it. Honestly, they deserve a lot of accolades, because it's not something I think I can do. But that is their lifestyle, so probably it's something they are used to already. It's just like my doctor work too. So that's it. You apply that all over your face, so you can see that the face is much, can you see? Yeah, calmer, brighter, less oily and all that. So, and it's all out on my palms. So from there, remember that I mentioned that I do not have brows, and you will not catch me dead going to work without my brows. I need to put my brows, I need to fill in my brows. So I have different pencils. I have the very cheap one. The cheap one, I think I buy it for 100 naira or 150. I have the other ones that I buy for like 1,200, 1,500. So this is Tara eye pencil, Tara brow pencil. This is Beauty Treats brow pencil. Funny enough, the one that is 100 or 150, I actually really like it because it's light. It's not really, it's light and it glides on the on the brows easily. Okay, so this is not a professional brow thing, so just take whatever it is that you see, just take it like that for me. Okay, so I use my hand to brush up whatever it is that I have there. I have this brush, my mascara wand, you know, that has finished, so I just brush it up, you know, just brush it up. Okay, just brush up the non-existent brows. Okay, I did microblading at the time, but it's not something I really want to continue, so I don't want to continue doing that microblading thing. So I just feeling maybe once I have enough money, I'm going to ask Megan Good, who our doctor was, you know, the doctor that did our brow transplant thing. Did you see that thing? Amazing. So then I'm going to go for a brow transplant. You know, it's something I'm deficient in, and it's something that I really want my brows to fill up. Okay, so I go with my pencil. And so people that, you know, that are makeup gurus, do not look at this video and you're like, what is she doing? This is Dr. Gold's method of filling in her brows. Just take it like that. Whatever you see, take. So I go just try and follow the line of what is there normally. I really don't have time to, you know, to do all the highlights. And as I said, this is not a makeup video. This is just me showing you what I do in the morning before going to work. I do not have time to do all the, oh, use one brush, use the something. So if you are a makeup person, do not have a cardiac arrest when you are watching this video. Okay, you can volunteer to, you know, to come and give me some lessons, but as far as Dr. Gold is concerned, this is how she's going to work. Aren't you loving this thing already? But she's fine. Look at it looking good already. So compare and contrast. Can you see the side that I filled in? Look at it looking good. So the thing about this brows, I've realized that one always looks better than the other. I don't know why. And one always looks better than the other. And for me, I think for this one, it's going to be the first one I do. But let's see. Let's see. Let's see my CC Ibadan brows that I'm trying to do. I really don't like thick brows. I like it looking as natural as possible. So I have the highlighter, but I can't find my brush. I have the highlighter. I can't find my makeup brush. There's a bag that anyway, sometimes I use the highlighter and I put something right there. So this is my makeup purse. This my, you know. So I use something to just highlight the brows. This is I think this is by Maybelline. So I just use their concealer or whatever it is, just to do something on the brows. All this is done in, you know, 5-6 minutes normally, so it's not like it takes time. So let's put something. I just put it right there. Just try and, you know, brush something into place. Same with the other one. Okay, I think this will do. What do you think? I think this will do. So the next thing I do is that I think there's a color, there's a shade of red or wine for every woman. So I like Tara. There's this Tara pencil, Tara lip pencil. It's called Kasua. So that I used to line my lips. But somebody needs to speak to them over there. I don't know what they are doing. The wood that is used in making the pencil, that pen, it just breaks easily. You have to sharpen it every single time. It breaks easily, and even with the sharpener, it still breaks easily. I complained the last time I was at their store. Somebody needs to talk to them. Otherwise, the pencil is fantastic. So, you know, just line the lips. Like I said, makeup gurus do not shoot me. So that's it. Then sometimes I either use this I've forgotten the name of this. It's by Tara too. It's a matte lip gloss. I really love it. It's called Daraima. Yeah, I remember now. Daraima. I either use that or the lipstick, Farida lipstick. So for today, I think I should use this Daraima. It's close to the shade of the lip pencil, but I like the way it looks. Just makes my face pop. You know, I'm dark in complexion. Anything wine goes well on my skin tone, so just put it there. You don't want to put too much because I'm going to work in the teaching hospital. You want to look, at least you don't want to look like you're going on the runway. So that's exactly what I use. The Darima lip pencil or the Darima lip gloss, the matte lip gloss. If not for face mask, now this is what you'll see every day. Most times this is what I use almost on a regular basis. Or Farida lipstick. So if I use the Kasua pencil, I use the Farida lipstick. Or this other one, I don't know the name of this one. Okay, the Alero. It's also another matte lip gloss from Tara. So I do a lot of things from Tara. I'm not really a fan of their powder. I break out when I use it, like most other products. But I found the Estee Lauder powder seems to work for me. But this particular, their pencils, their lipstick and all that, I really love them. So that's it. I'm ready to go to work. As far as I'm concerned, I'm slaying, whether you believe it or not. From there, and we went to this. What do you think? So that's all with my, my morning routine and how I, get ready when I'm going to work. But, I forgot to mention, this is another toner by Geek and Gorgeous. I like it too. It contains panthenol. It also has NMF, so I really like it. I use that especially when I'm not breaking out. I prefer the Naturium toner, but sometimes I use this. So at night, what do I do when I come back from work? I don't use any brown powder. So for oil cleansing, I really don't need much of that because I don't use brown powder on a daily basis. If I use brown powder or foundation, concealer and everything, then oil cleansing will be appropriate to wash my face when I come back. But really, I don't use all of that. So I just go into the bathroom, put some cleanser on my face, either my benzoyl peroxide, but usually most times this. Sometimes I even use my Dove moisturizer soap to wash my face. So I wash my face at night, depending on if I'm breaking out. If I'm actively breaking out or my face is maybe I'm up and preparing for a procedure, a chemical peel or something, I use my 0.05% tretinoin cream. So it's supposed to be a prescription vitamin A analog. So I use this 0.05% tretinoin cream every night all over my face. But sometimes I use retinol instead. And the funny thing, these advanced clinicals, I've been seeing their products a lot on Amazon, in the stores and all that. And I would look at it with side eye that I'm sure this thing is not good. It's so big and all that. But I tell you, if you want to save, when they say buy one, get 2 or 3 free, advanced clinicals, their stuff is amazing. I love their retinol. Another thing you can even do, if you have, you have hyperpigmentation on your skin and you have some, you want to take out, you want to let those hyperpigmentation fade out gradually, you can use the advanced retinol vitamin C cream as your regular body cream. You can use the advanced, because it's large enough to use as your regular body cream, and you can also use it as your face cream. So I use this at night sometimes, on my face. Sometimes I use it when I have my bath at night just to moisturize my skin. So that's about it. All done. And please, like I said, don't think that I'm using everything all at once. I've told you that my cleansers for washing the face, I use different ones depending on, how my skin is acting up at the time. So what do you think? From bare to slim. Am I slim? Tell me the truth. Am I slaying or I'm just deceiving myself? Anyway, maybe the next time I'm going to get somebody that is going to do a full face of makeup on me. But this is the way I go to work. Normally, I don't really like eyeshadow. I don't do a lot of that. Sometimes I do a pencil, a kajal pencil to line my eyes and all that. But generally, on a good day, this is the kind of makeup I wear to work. Hit or miss? What do you think? Hit or miss? Hit or miss? You better be saying hit, else. Anyway, thank you for watching. I'm sure you've learned a lot from the video. You've learned about how to care for your oily skin, the basic skincare tips that I've talked about before, but I'm even elaborating further in this video. The way you can go from bare to slay like Dr. Gold. And I'm sure that after this video, you're going to call a friend, call another friend, call your family and friends to subscribe to Skin and All YouTube channel. Thank you for watching. Until next time on Skin and All YouTube channel, stay safe and take care of yourself.